Amanda with StraightSmile Solutions, StraightSmileSolutions.com. As always, any of these resources that we're telling you or showing you on YouTube are available to any licensed dentist in the whole world. All you have to do to get a copy of them is go to our website at StraightSmileSolutions.com and schedule a complimentary consultation and let us know what you're looking for, and we'll be glad to give it to you. So, anyways, today we're going to be talking about diagnostic and treatment planning forms. I do have this form that's available. Like I said, just contact us and we'll give it to you. There's a lot of information here. We could probably take like 4 hours to go over this form. It's a two-pager, but I'll just like lightly go over it. Obviously, when we're initially screening a patient, we're thinking about their chief complaint. Is this going to be a phase one or a comprehensive case? Are we going to put this case into recall maybe and take a look at them later? What type of recall cycle are we going to put them on? I'm going to bust out the panel. We're going to take a look and see if we see any impacted teeth, absent teeth, missing teeth, anything like that. Always, always count teeth. That's a little tip for you. Then we're going to start looking at the issues in all different planes of space. We're going to look at transverse issues. We're going to look at vertical issues. We're going to look at AP issues, all that. And obviously, we're going to look at crowding and spacing. We're going to look at profiles, arch forms, angles class of occlusion. Are we going to treat it in-house? Are we going to refer it out? About how long it's going to take? So for me, I know that it's always good to kind of write down, God, I hope nothing's taking 30 months. This is kind of old school. But I actually like to have a set price for, set price for phase one, a set price for branded aligners, a set price for unbranded aligners, white label aligners, and a set price for braces. 4 prices. That's it. When you start getting into this whole like 6 to 12 months, 12 to 18 months, first of all, sometimes it's really hard to predict. And then sometimes you're going to have a super compliant patient that just gets done way earlier. And, then they want refunds because it took less time. And then you have someone that's non-compliant and do you charge them more? So I just like to have set prices. Obviously, I do believe in having a compliance contract. That's really important. That's something we can talk about. Another resource that we have. So if the patient is repeatedly breaking brackets, not showing up for appointments, not brushing, then, 1, 2, 3 strikes, you're out. And you can do a braces vacation and bill for obviously services rendered. And go from there. So, you need to be really kind of clear on the front end about how that's going to work in your practice and what your expectations are with hygiene and breakage and stuff like that for braces, but for aligners, wear. And then you also want to have some type of plan that you set out on the front end for aligner patients if they need to convert into braces patients. How much is that going to cost, and what is that going to look like, and at what point do you give a couple warnings and then convert them. So of course this is some elastics. This is some brands of elastics. For the most part, elastics that I stock in my office is going to be the 3/16 or the 1/4, medium and heavy. That's going to be pretty standard. I don't use these too much. I don't use these too much. I don't use these too much. The really big ones are going to be extra oral elastics for face masks, and I do use those. So yeah, that's pretty much it. There's a bunch of stuff down here. I don't use all this stuff, but some of the stuff I do use. It's pretty good stuff. And extractions, hopefully not. Extractions for me are a very, very last resort. I'm really into treating early. As young as age 4 or 5, there's tons you can do and a lot of products out there. They do not have to be expensive. So much you can do. So, and no, you shouldn't be waiting till the child is 12 or 13 in some circumstances. In many circumstances, it can be so much easier. There's all kinds of cool wires. For the most part, I'm only going to use 4 wires. I'm a minimalist. So I'm going to try to put the biggest possible round wire in from the first appointment. Usually it's a 16 9 tie. If they're super crooked, it's going to be a 14 9 tie. Sometimes it's going to be an 18 9 tie for first wire. So second wire is usually going to be an 18 9 tie. Third wire is usually going to be a 1725 9 tie, and fourth wire is going to be either an 18 or a 1925 9 tie. 4 wires, that's it. And I don't like to go back and forth. So once I get to 18 9 tie, I'm going to reevaluate the case, see if I need to do any bracket repositions. Not only, so I'm going to be looking at, the first order movements, up, downs, verticals, and in, outs, rotations. I want it to be totally perfect. The wire should be passive, and the bracket should be totally perfect. I should be 100% happy with the bracket placement. Not only should I be happy with the bracket placement 100%, I'm going to pass it on to the parent and the patient and give them a mirror and give them a month to go and talk to their friends and family members, because if they have an issue, and a lot of times there's a lot of art that goes into, um, you know, art that goes into idealizing a smile. It's not just my way or the highway. So, sometimes people, they like their canines more stepped up or stepped down, or they like their laterals more stepped up or stepped down. Usually, um, you know, they have some say in the matter, and I want them to have some say in the matter. And if they have an issue with the position of the brackets, I would rather hear at this 18 nice size stage right here, which is usually, maybe like 3 to 6 months into treatment, than here at the end, and we have an agreement that we're happy with the way the teeth look at this stage. And if we're not happy, then we're going to go ahead and reposition the brackets until everyone's happy. And hopefully, if you're using indirect bonding, you really shouldn't have any of this, because you should be showing your patient the digital setup before you place the brackets, and make sure you're all in agreement with how it looks. So that's why I love indirect bonding. So make sure that you are considering taking our indirect bonding course, our straight wire course. We're offering it twice per year. The next one is going to be actually in a few weeks in Phoenix, Arizona. So make sure you go to straightsmilesolutions.com/media to go ahead and sign up for that course. We're still offering a promo for another few days. So we do have some cool stuff going on. Anyways, okay, back to wires. So we're back to wires. After the 18 9 tie, we're going to move on to the rectangular wires. I don't do any space closure, maybe 2 to 2 on the upper teeth if there's a gap, a diastema, just to make them happy. And if I do 2 to 2, I'm only going to go mesial to mesial. That's it. Okay, 7, 8, 9, 10. Mesial of 7 to mesial of 10. And not crazy tight. I don't do the rest of the space closure until we get into the rectangular wires. Okay, and that's it. And the same thing goes with most elastic wear isn't going to be later. I will do box elastics in the 18 night tie, but besides that, or triangle elastics, but besides that, no more elastics. No class 2, no class 3 until we're in bigger wires. And that is pretty much it, besides maybe occasionally a reverse curve, and we just did a video on that. That's pretty much it, my friends. So 4 wires if possible. Make sure everyone's on the same page. Don't try to get ahead of yourself with a space closure. That's one of the biggest mistakes I see that people do. And that's about it. So yeah, that's treatment plan. So the goal is to get those braces done as soon as possible, really quickly and efficiently, and everyone to be really happy. And like I said, be honest with the patient on the front end. Hey, you've got some crowding, you got some spacing. This is the way it's going to go. We're going to try to do 4 wires, okay? We're not going to really tackle most of your bite issues or your spacing issues until we get into our 3rd wire. So, and we're not even going to move on to our 3rd wire until both of us are really happy about your crowding and it's 100% resolved. So, bear with us. There's a system to this, and we're going to tackle one thing at a time, and that's going to allow us to finish this most efficiently. So, anyways, that is my treatment planning philosophy. So, hopefully we can talk more about it. So don't forget to visit straightsmilesolutions.com. All right, and if you want a copy of this, you know where to get it. All right, thank you.